Reading an IV order.
Orders for intravenous IV therapy may be standardized for different illnesses and therapies, such as burn treatment, or individualized for a particular patient. Some facility policies dictate an automatic stop order for IV fluids. For example, IV orders are good for 24 hours from the time they're written, unless specified. A complete order for IV therapy should specify see illustration below, type and amount of therapy, additives and their concentrations, such as 10 milliequivalents, potassium chloride in 500 milliliters, dextrose 5% in water. Rate and volume of infusion. Duration of infusion. If you have an order that's incomplete or seems inappropriate because of the patient's condition, consult the prescriber. Here are a few sample IV orders. A 75-year-old client is admitted to the hospital with lower GI bleeding. His hemoglobin on admission to the emergency department is 7.3 grams per deciliter. The physician prescribes 2 units of packed red blood cells to infuse over 2 hours each. The blood administration set has a drip factor of 10 drops per milliliter. What's the flow rate in drops per minute? Each unit of packed red blood cells contains 250 milliliters, which should infuse over 2 hours, 120 minutes. So the rate per minute is 250 milliliters per 120 minutes equals 2.08 milliliters per minute. Multiply this rate by the drip factor to determine the flow rate. 2.08 milliliters times 10 drops per milliliter equals 20.8 drops per minute. Round up to 21 drops per minute.
Second scenario. A nurse is caring for a client who recently had a bowel resection. The client has a hemoglobin level of 8 grams per deciliter and hematocrit of 30%. Dextrose 5% in half normal saline, D5.5 NS, is infusing through a triple lumen central catheter at 125 milliliters per hour. The primary care provider's orders include 1. Gentamicin, garamycin, 80 milligrams IV. Piggyback in 50 milliliters, dextrose 5% in water, D5W over 30 minutes. Second, ranitidine, Zantac, 50 milligrams IV in 50 milliliters, dextrose 5% in water, piggyback over 30 minutes. 3 units of 250 milliliters of packed red blood cells over 3 hours. Fourth, nasogastric tube flushes with 30 milliliters, normal saline solution every 2 hours. If all of the above is infused, how many milliliters should the nurse document as the total intake for the 8-hour shift? Add up the total intake as follows. Regular IV of D5.5 NS at 125 milliliters times 8 hours equals 1,000 milliliters. Gentamicin piggyback equals 50 milliliters. Ranitidine piggyback equals 50 milliliters. Packed RBCs, NANR 250 milliliters. Nasogastric flushes, 30 milliliters times 4 equals 120 milliliters. Total intake equals 1,470 milliliters. Third scenario. Continuous bladder irrigation, CBI. After a retropubic prostatectomy, a client needs continuous bladder irrigation. The client has an IV of dextrose in 5% water, infusing at 40 milliliters per hour, and a triple lumen urinary catheter with normal saline solution infusing at 200 milliliters per hour. The nurse empties the urinary catheter drainage bag 3 times during an 8-hour period for a total of 2,780 milliliters. How many milliliters does the nurse calculate as urine? During 8 hours, 1,600 milliliters of bladder irrigant has been infused. 200 milliliters times 8 hours equals 1,600 milliliters per 9 hours. The nurse should subtract this amount from the total volume in the drainage bag to determine urine output. 2,780 milliliters minus 1,600 milliliters equals 1,180 milliliters. Total output is 1,180 milliliters. Fourth scenario. A client has a cerebral aneurysm. The physician orders hydralazine, apresolin, 15 milligrams IV every 4 hours as needed to keep the systolic blood pressure less than 140 millimeters of mercury. The label on the hydralazine vial reads, hydralazine 20 milligrams per milliliter. To administer the correct dose, how many milliliters of medication should the nurse draw up in the syringe? Use this formula to calculate the drug dosage. Dose on hand divided by quantity on hand equals dose desired divided by x 20 milligrams per milliliter equals 15 milligrams divided by x equals 0.75 milliliters. Fifth scenario. A client is ordered a dose of apoetin alpha to treat anemia related to chemotherapy. The recommended dose is 150 units per kilogram. The client weighs 60 kilograms. The vial is labeled 10,000 units per milliliter. The nurse should administer how many milliliters of apoetin alpha? First, determine the number of units of apoetin alpha the client is to get. 60 kilograms times 150 units equals 9,000 units per kilogram. Next, determine the number of milliliters required to deliver that dose. 10,000 units divided by 1 milliliter equals 9,000 units per x. 10,000 x equals 9,000. X equals 9,000 divided by 10,000. X equals 0.9 milliliters of apoetin alpha. Thank you for watching. I hope you learned something.